My name is Dr. Caroline Chepkwony. I am a specialist in internal medicine and also consultant cardiologist with Akhk Hospital in Kisumu. And I deal with problems like heart failure, also problems like coronary artery disease, like heart attacks, structural problems. And I just want to talk about a patient experience that we had last week. Now, people will wonder, what is a pacemaker? So when we are born with a pacemaker that is working right from birth. And the pacemaker helps the heart rhythm to be about 60 to 100. When the rhythm is good, the heart depends. So the heart is a pump that it squeezes to pump blood outside the body, and then it relaxes to allow blood to come in. So the pacemaker is found in the upper chamber. So the heart has got 4 chambers, the 2 lower chambers and the 2 upper chambers. One of the chambers houses the natural pacemaker that you are born with. So when that pacemaker triggers, it's like electricity. So that electricity travels down to the heart muscle, and then it gives the muscle power to squeeze, to push blood outside. Now, when that is impaired in what is called complete heart block, so that generation is impaired with, and then sometimes the generation is happening, but then there's degeneration of that channel. So then the rest of the heart is not getting that stimulation from your natural pacemaker. When that happens, you feel like your heart is failing. You get headaches, you feel dizzy, because the blood is not leaving the heart to go to the brain, to go to the rest of the body. So you feel tired, you feel dizzy, you get headaches, and you just feel generally unwell. Some people actually faint so many times. So when that fails, we make the diagnosis by, generally how the patient is coming. The examination, as I said, the heart rate will be low. Maybe for some patients, 40 beats per minute, 35. Our patients had the lowest, the worst, which was 15 beats per minute. Now, when that fails, there's no medicine to restore that. There's no medication that you'll be given to bring back that pacemaker. This degeneration happens as you grow older. So this problem is mainly found among the elderly patients, but we've even seen young people, like a 20-year-old, having their natural pacemaker failing. So technology has really advanced now, and we have companies that manufacture external pacemakers. So they make a battery. There's a special way that you make it. Each battery is connected to 2 wires. The battery usually has a life of 10 years. So when we implant, we put it under the skin. The pacemaker lead is under the skin. It's an operation that takes about 2 hours. And then the wires are directed through the vein to come to the right side of the heart. So one of the lead will be in the right ventricle. This is the right ventricle, and that is the left ventricle. So one lead will be here on the right ventricle, and another lead will be in the right atrium. And it's a specialized kind of cardiac device, but it really helps patients. It improves your quality of life from almost zero, because when your heart rate is low, you can barely even walk to the bathroom. As soon as that pacemaker is implanted by the right people, qualified doctors, your quality of life improves, because now your heart starts working optimally, and you'll be able to carry on with your life. So it's a procedure that is done in theater, takes about 2 hours. We don't open your heart. It's not open heart surgery. It's done when you're actually completely awake. We just use local anesthesia around the left side of the chest.
Mimi naitwa Keziah Mboga. Natoka Hamisi, Vihiga County. Nilikuwa mgonjwa tangu siku ya Jumatano kuanzia saa 12 ya jioni hadi saa 1. Nilikuwa naanguka tu chini na zimia. Watoto wakaamua kunipeleka hospitali, nikaenda hospitali.
On Wednesday night, She was not feeling well. We received a call, and then we asked her how was she feeling. She said she was feeling dizzy. And for us, we thought that since she has been having blood pressure for long, we thought it's just the problem of high blood pressure. So we took her to a hospital where she was checked by the doctor. Then the doctor said she's having a heart problem. She was referred to Mbale Hospital.
Wakaniambia niende referral, waende wanifanyie surgery ya moyo. Kufika huko wakaniambia niende Kakamega, hawana vifaa ya moyo. Kufika huko Kakamega nikaambiwa nitaenda referral. Kufikiria kwenda referral, kuna daktari mwingine akaniambia enda Kisumu kwanza register huko.
My colleague from Kakamega called me in the morning that he was having a patient who was not well and who needed to be evaluated by a cardiologist, and I asked him to send the patient over.
Kufika Kisumu nilikuwa nimelemewa sana. Wakaniambia kweli tunaweza kuweka kwa grupu yenye wanaenda tarehe 29 mwezi wa 9, lakini huko hutafika.
So the patient arrived at our emergency area, and the nurse called me immediately to go and see that patient. I rushed. I went very fast to evaluate the patient because there was the risk of the heart stopping at any point because the heart rate was pretty low.
So on 23rd August, around 1:10, I received a patient in the observation area from a triad nurse. And this patient was presenting with dizziness, very severe chest pain, and was also very fatigued. I did an ECG of this patient and it showed complete heart block. Informed the emergency room doctor immediately on the same patient. And we also informed our cardiologist, Dr. Chepkwony. Together as the emergency room team, we rushed the patient to our resuscitation area here where we are.
So the nurse was almost panicking because when she tried to take the measurements, the vital signs that we do for the patient in the emergency room, she discovered that this patient's heart rate was very low.
So upon taking my initial vitals, I realized the pulse rate of the patient was low. It was at 15 to 22 beats per minute, which is very low. The blood pressure was unrecordably low again.
The blood pressure was actually unrecordable because of that very low heart rate.
The oxygen saturation was normal. It was between 98 to 100%. Respiration rate was also very low. It was between 7 to 10.
The normal heart rate is about 60 to 100. And so the reason she was panicking is because that is, an alarming finding. Because with that heart rate of 15 beats per minute, her heart was too slow and the patient was quite sick. She was feeling dizzy. She couldn't even open her eyes properly, and she was being supported actually to come into our facility. There was even a history that she had fainted at home the previous week. So I quickly noticed that her pacemaker was not working. And so we usually in our emergency room, we have a way that we try to pace the patient, transcutaneously through the chest. So we tried that with our defibrillator machine to do transcutaneous pacing.
The cardiologist ordered for TCP, transcutaneous pacing first. So we did this for about 1 hour. Our patient was still not really improving, still deteriorating, was still hemodynamically unstable. Our cardiologist again changed the order to dopamine, which we started infusion. But meanwhile, we were also cleared to rush the patient to theatre.
With the transcutaneous pacing, we managed to just go up to 20 beats per minute, so it was not successful. Now, I had already gathered a team just to be on standby in case we needed to resuscitate, in case the heart stopped abruptly. We had our ACLS team ready, our nursing team, our physicians, myself, and also Professor Yonga, who usually supports us in this service.
Walishughulika na mimi jinsi Mungu amewapea ujuzi wao kushughulikia wagonjwa wa moyo. Hata vile nilienda upasuaji sikujua, lakini nilishtukia tu nimetoka huko, nimeweka kwa kitanda, nimelazwa na nimerudisha uhai wangu. Nashukuru madaktari wale walinishughulikia Akhk. Niko mzima. Saa hii nashukuru, nataka enda nyumbani. Wameniambia tarehe ya kurudi cheki. Tutakuwa nao pamoja na Mungu mwenye anawashughulikia pamoja na mimi. Nashukuru sana. Akhk ni hospitali mzuri. Kilemewa ukifika huko pamoja na Mungu, kuna madaktari huko wenye wamesomea moyo wanaweza kukushughulikia.
So the patient was taken to theatre where the implant was done.
So our patient's procedure was successful. In 1.5 hours we were done. Next month is going to be World Heart Day, and so her case has really opened up and has started as well as we are gearing up for the World Heart Day. Thank you.